Hi, this lecture is the first lecture in our course, Basics of Clinical Nutrition. Let's start with our first lecture, the introduction. Let's start together. First, you have to ask yourself a question. Why nutrition science? Why you start studying nutrition? Why you start your career as nutritionist? This question can be answered on two sides. On one side, according to patient or client, they may select foods that influencing their health, either by increasing the risk of suffering from obesity or by increasing the risk of chronic diseases, such as diabetes and hypertension. So increasing the risk of early death. Unfortunately, the number of people suffering from obesity nowadays is very large and is increasing day by day. And don't forget, that's why I have written, keep in mind, obesity is the fifth cause of death. So it will be the reason that will help someone to change his life to a healthy lifestyle and to protect him from chronic diseases. In addition, you will always find clients. This career has been one of the most important careers. That's why, on the other side, according to you, nowadays nutrition field has become one of the most important careers, as you have many opportunities. Number one, clinical nutritionist. This one who is responsible for managing the nutrition for patients in hospitals. Number two, therapeutic nutritionist. This person is responsible for making customized diet plans for patients who are suffering from chronic diseases. Third one is sport nutritionist. His role is to make customized diet plans for football players, basketball players, in clubs and gym. Fourth, nutritionist specialized in obesity treatment. Fifth, online nutritionist. You can work as online nutritionist or online coach. It will help to guide many people to reach their target just online as a freelancer. But you are building your own name. What is your role as a nutritionist? Your role as a nutritionist not only to give someone a diet to move on and lose weight. No. Your role is to help someone to change his lifestyle to a healthy lifestyle, to help him to be fit, to help him to decrease the risk of being suffering from chronic diseases such as diabetes, hypertension, cardiovascular diseases. So your role is very important as you will help someone to change his life to a better life. Then, what affects the choice of a person? First, preference. What do the client or patient prefer? Sweetness of sugar, salty food, and of course, salty food can lead to some diseases such as hypertension. Hot peppers in Mexican food, curry spices in Indian food, hormones in pregnancy can always influence the choice of food for the pregnant woman. And there are some researches suggest that genetics may influence taste perceptions. Number two, habit. How you are raised up. Some people are raised up on eating salty food. Some people are raised up on eating sweets. Third, traditions and in different regions. As Mediterranean diet, if you have listened about it before. Mediterranean diet in the Mediterranean regions. They are known to eat fish a lot. In addition, as I have said before, hot peppers in Mexican food. Fourth, social interactions. If you hang out with your friends, so they will ask you to eat with them fast food or sweets. Social interactions have an effect on the choice of food, availability, and economy. This is very important, of course, for you. Why? Because, of course, you may find a client who is poor or he can't afford to buy many types of food. If you see this client, you have to choose him sources which are cheap that will help him to move on diet and continue and without paying a lot of money. Emotions and of course emotional pain. Many people who are in pain may lead to either avoid eating or eat a lot of food. So this affects the choice of food. Body weight and image. Of course, many people nowadays are trying to lose weight and be fit to improve their image and their appearance and to be fit in clothes. And this is very important and will help you a lot if you find a client like this because he has a strong will to lose weight by you. What are nutrients? Nutrients can be classified as macronutrients or energy yielding and micronutrients as non-energy yielding. Macronutrients are carbohydrates, protein, fats. Micronutrients are vitamins, minerals, and water. They can also be classified into organic, which are carbohydrates, protein, fat, and vitamins, and inorganic, minerals and water. Carbohydrates, protein, fats will be discussed later in details in the course. We'll talk about the function of each of them, the metabolism of each of them, best sources of each of them to be chosen in the diet, and the percentage of each of them in a balanced diet, and how to calculate them by yourself. Minerals. They are found in the fluid in the body, teeth, and bones. There are about only 16 minerals known to be essential in human nutrition. Why the expression of essential? Essential means that your body can't synthesize them. You have to take minerals from outside source, such as food or supplements. But take care, there are other minerals such as lead, which is environmental contaminant that harm human nutrition and can displace the nutrient minerals. According to vitamins, they don't produce energy, but they facilitate the release of energy from carbohydrates, fat, and proteins, and participate in numerous other activities throughout the body. Vitamins, this name comes from vital. It's very important. So vitamins are very, very important. That's why in the diet should be always balanced and you eat vegetables and fruits to get vitamins. There are 13 vitamins. Each of them has its own role, such as one helps protect the lungs from air pollution, another helps stop the bleeding, and another helps repair the skin. Vitamins can be classified as water-soluble vitamins and fat-soluble vitamins. And I will discuss this in details and about the doses of vitamins in another course, and it will come soon. Follow me. Water. Water makes about 60% of human body. It participates in many metabolic reactions, supplies the medium for transporting vital materials to cells and carrying waste product out from them. Water makes about 60%, as you see in this picture. Fats, about the normal percentage of fat, about 18 to 21% for young men, 23 to 26% for young women. Carbohydrates, protein, vitamins, minerals, and other minor constituents make up their meal. So, our first lecture, the introduction, has been finished. The next lecture, we will talk about communication skills. How to communicate with your client or patient with different personalities in order to help them to reach to their targets. Let's continue our course, Basics of Clinical Nutrition.